Welcome to Shape of the City. I'm Clover Frederick and I'll be your host. The Mental Health Association of Nebraska is continually finding new ways to make life for those with behavioral health issues a little easier. This summer marks their one-year anniversary of their Honu Home. To find out more about the Honu Home, as well as the other mental health programs in Lincoln, I'm joined by Destinie Commuso, Dillon, and Amie Jackson from the Mental Health Association. Thank you all for joining me.
Thank you.
Thank you.
All right, let's start with Destinie. Now, tell me more about Mental Health Association and some of its programs.
The Mental Health Association was incorporated in 2001. We're a completely peer-run organization, meaning all of our staff and our volunteers are people with lived experience, whether it's with mental health or addiction, previous incarceration, most of the time, all of them. And our programs are really focused on prevention. And so our first program was our supported employment program to help individuals living with behavioral health issues get back to work their way off of Social Security benefits if that's what they want. Just kind of giving them the support to be able to do the things that we all want to do. And then we got the Kia House, which is a 5-day respite, hospital diversion house, 24-hour peer support. And then the corrections program, which involves the supported employment, the REAL program, which is our outreach, and then Honu Home, which is Honu is an up to 90-day stay program for people coming out of state correctional facilities or within 18 months of release. The way it works is they can stay for up to 90 days, completely free to them. The idea is the wraparound services. They come to the house, they get an employment specialist, they get an outreach worker. It's on average taken our folks about 2 to 5 days to find employment. So there's actually a lot of jobs out here in Lincoln. But after they find their employment, they start saving up for rent and deposit, and they're building their relationships back with their family. They start working with our outreach. And our average stay is about 66 days, and outreach plays a big part. They help them transition into the community, into their own housing situations.
So it sounds like it's been really successful in its first year.
Definitely. The first year went really fast. We opened the house June 19th of last year, and we've served close to 40 individuals just at the house alone, with an average stay of 66 days, and they've all transitioned into their own living situations. So it's went really well, and they get the 24-hour peer support. People, they think that they do their time in prison, but really their time starts when they get out, because they get all the barriers and sometimes the stigma and the struggle of having to get all your things back in order and your basic needs met. So the house is really supportive. You know, if they have a hard day, they can go back to the house, and there's always staff there that's going to be there to talk to them and support them. And then we also run a 24-hour warm line at Honu for people coming out of corrections if they just need to call and process thoughts, or if they're, just having a bad day, they can just call and talk to us.
Okay. How did Honu House get started?
The Nebraska Department of Corrections put out an RFP for reentry programs. We had already been kind of assisting people coming out with support. So we did write a proposal, and luckily we did receive one of their reentry grants. And it is focused on vocational stuff, but we were able to stick a house in there somewhere because, a lot of people coming out, they don't have anywhere to go.
Right.
And you have to parole to somewhere. They don't let you parole to homelessness or to the mission. So the house has really come in handy for those folks who don't have all the family support that some do, or a lot of friends. And Nebraska actually doesn't have a lot of transitional living for people coming out. So that's kind of how it got started. We just last month was what do I want to say, refunded for the next 2 years.
Oh, great. Good.
So we'll be doing this for the next couple of years at least, hopefully longer.
Good, good. Well, now let's talk to Zach and Amie. Now there are some other support programs involved here. Tell me a little bit about them.
Okay, I work for the HOPE program, which is the Higher Opportunities Through the Power of Employment, and we do supported employment, which the house and everything, and the grant is based on, the ideas to help these individuals when they come out obtain and maintain employment, and that's what I do. But it's easier to get somebody employment, but if they don't have a place to lay their head and shower and the daily necessities, that's where we come into some struggles. So we help people obtain and maintain employment, and we write resumes, cover letters. We do job coaching, interview skills. We'll do on-the-job training. We also just anything we can do to help them stay employed. Yeah.
Okay, good. And Amie?
I work for the REAL program. That's our outreach services. And what I will do when they first come out is make sure their basic needs are met: clothing, hygiene, medications, community resources, food. All of those basic needs need to be met before they can move towards their recovery and wellness. And a big part of what I do is help them search for housing and advocate for them on their behalf, and let the landlords know that they're going to have continued support. Our support doesn't end. We still have people that we started with a year ago that we still make contact with and support.
Good.
That's a really cool thing about peer support is we don't have a discharge date, and we're not Monday through Friday 9 to 5, because nobody really has problems Monday through Friday 9 to 5. It's 2 o'clock in the morning or on a Saturday, and we don't discharge people. They kind of let us know when they're ready for us to give them some space.
Okay.
And then also, connecting them to community resources and helping them navigate what is available in the community.
Right. Okay, good. How important are programs like this in our community?
I'd say it's really important because over 90% of the people that are going into prisons are coming back into our communities. And it is really rough when a lot of landlords will not rent to anybody with a background. A lot of jobs, prefer that you don't have the background. It's really a community effort, and we really have to work together on helping these individuals return to the community because they're going to be in our community. And if we make it easier, then they'll be more successful, and they just need the extra support.
Mm-hmm. What key messages do you have to let the community know about what people with mental health struggles are going through?
I would just keep an open mind, and nobody wakes up one day and asks to have a mental health issue or an addiction issue. So to keep that in mind and to really maybe do some looking into mental health, and it's not just what you see on TV, and they're not bad people. They just a lot of times they're in bad spots at bad times, and things happen. And just we got to give more chances. Everyone deserves a second chance, and I think as the community we got to get better at giving second chances.
Good. Now, where can viewers go to learn more about Mental Health Association's programs?
You can go to mha-ne.org, or you can call our office and we can send you information at 402-441-4371.
All right, very good. Well, thank you all for joining me
Thank
today.
you.
It's
Thank
great
you.
information. Very
Thanks.
good.